Have you recently undergone hip replacement surgery, and are you concerned about maximising your recovery and making sure that your joint is well protected during that time? If so, you've come to the right place today, because we're going to be talking about how specialist seating can aid your recovery period. My name's Jude Brewer. I'm an occupational therapist with 20 years experience working in different clinical settings, including community, inpatient rehab, acute settings and care homes. So the golden rule after hip surgery is not to bend your hip greater than 90 degrees. And this applies when sitting, when moving between sitting and standing, and not just on your lounge chair, also getting on and off the toilet. Seating is often too low, so that's where specialist seating really comes in and is quite critical, especially in the early stages post-surgery. As well as the 90-degree rule, it's important to remember not to twist, not to cross your legs, and not to bend forwards at the hip during the post-operative recovery period. It usually takes about 6 to 12 weeks to recover from hip replacement surgery, and during that time it's really important to follow the advice given to you by your clinical team and by your surgeon, and moving forwards from that as well. So I'm going to demonstrate the appropriate way to safely sit to stand after hip replacement surgery. Before sitting down or standing up, always ensure the brakes are firmly engaged to prevent the chair from moving and to provide a stable base for a safe transfer. If you have a walking aid, you'll have that in front of you and be using that for support. You want to slowly and carefully step backwards until you can feel the chair behind both of your legs. Move the operated leg out in front and then reach back for the armrest of the chair, and slowly move yourself down to sit. When standing from a seated position, you'll want to shuffle your bottom forwards to the front of the chair, move your operated leg out in front, and then push up using both arms through the armrests of the chair. If you're standing with the aid of an electric chair, you can either ask a carer to help you with the controls if you can't manage that safely yourself, or if you can, then press the button to stand, and it will slowly bring you into that standing position. Move your operated leg slightly out in front and then push through the armrest with both hands to stand. So considering appropriate seating after hip replacement surgery, something like the Lento mobile chair might be great for meeting your needs. It has a number of adjustable features, such as the adjustable armrests, the adjustable seat depth. It has the tilt in space function. The electric rise function can be really helpful in the early days post-surgery because it assists you to stand up whilst alleviating some of that strain and some of that pressure through that operated leg. If you are currently requiring something like a stand aid to help you with your transfers, then this Lento mobile chair is compatible with that type of equipment. If you are still in hospital post your hip replacement surgery, something like the high back bedside chair might suit your needs. It is a static chair, but it has height adjustable legs, so you can set it to the appropriate height to ensure that you have the 90-degree angle at your hips. It also has a wipeable antibacterial surface, so it's really easy to keep clean. So if you are wanting to look at suitable seating post your hip surgery, Vivid Care do offer free, no obligation seating assessments. They can come to your home to do that, so it's really convenient. And aside from the purchase option, there is also a hire option. So if you're only needing seating for a short period of time, for example, post-surgery, during that post-operative recovery period, then that's an option that is available through Vivid Care.